All right, so this session is being recorded. Niyati and Felicia, the floor is yours.
Thank you so much. Yeah, we want to welcome you to our presentation of the impacts of COVID-19 and cannabis use in young Canadians. My name is Felicia Patch. I am a third-year Fleming College student, just graduating soon. And I had the privilege of being in the YMCA Youth Cannabis Awareness Program. We are presenting here today for y'all. And this is my my lovely presenting partner, Niyati Patel. Would you like to introduce yourself?
Sure. Hi, everybody. I am Niyati. I am same as Felicia. I am also Fleming College student, just graduating soon. I'm here. I completed my placement with YCAP, so I'm here just like share the research that we did for COVID-19 and cannabis use in young Canadians.
Okay, Steve.
So in this presentation, we are gonna identify the impact of COVID-19 on cannabis use among young Canadians. And then we are also gonna explore the factors that are like influencing the changes in cannabis consumption. And we are also gonna provide like key takeaways and research finding and also like suggestions for the future.
Yeah, so it was mentioned a little bit before, but just to kind of go over it, the data explored within this presentation has been collected from 3 national surveys and additional research reports. So the 3 national surveys that we explored is the Canadian Cannabis Survey, both in 2020 and 2021, as well as the Canadian Perspective Survey in 2021. We also pulled additional considerations from 2 reports titled, the first one's titled Measuring Self-Reported Change in Alcohol and Cannabis Consumption During the Second Wave of COVID-19 Pandemic in Canada. And then the second one is a longitudinal study of change in substance use from before to during the COVID-19 pandemic in young adults. And so, yeah, so that actually just informs our conversation just moving forward.
So the research that we did, like for Canadian Cannabis Survey, CCS 2020 and 2021, before we move with the data, let's like have a background information about Canadian Cannabis Survey. So it like conducted annually since 2017. CCS reported like findings by sex at birth. CCS 2020 like survey started April 30, 2020 and ended June 22, 2020. Survey results are like based on the responses from 10,822 respondents aged 16 and older across all over like provinces and territories in Canada. CCS 2021, like it started April 7th, 2021 and ended June 28th, 2021. Survey results are based on the same like response from 10,736 respondents aged 16 and plus, all over like across provinces and territories in Canada. I also like here want to mention that CCS like participants were recruited that they were informed that the survey was about cannabis. So like that information may have created like the participation bias in that those who use cannabis may have been like more likely to complete the survey. So that may impact the result of the survey. And like although also on a level of Canadian population, which are like specifically designed to measure the prevalence of use.
So just exploring the 2021 CPSS survey. So just a little background. The CPSS conducts a series of short online surveys that provide insight into how Canadians are basically reacting to the pandemic. So essentially there are 6 different surveys within the study, and the 6th one focuses on alcohol and cannabis use, which Niyati and I learned are the 2 most commonly used substances in Canada. So this particular series was conducted from January 25th to 31st, 2021. And then, like Niyati, just want to point out some limitations around this survey. So short online surveys can present some limitations for those who don't have consistent access to technology and attrition. So because the survey was 6 different series, we may not get the same volume of people in the latter series than we would in the earlier series.
So here's the question. So how has like COVID-19 impacted cannabis use trends among Canadian youth? So we are going to talk about it in the next slides.
Yeah. So here we look at a summary of relevant data, habit of consumption in the past 12 months, looking at basically a comparison of the CCS 2020 and 2021. So the 2020 and the 2021 CCS asked people who used cannabis in the past 12 months if their cannabis use had changed due to the pandemic. Overall, 56% of Canadians did not change their consumption, while 22% reported an increase and 22% reported a decrease. But in 2021, 51% overall did not report a change, while 27% reported an increase and 21% reported a decrease. So the change in the amount of cannabis used due to the COVID-19 pandemic seemed to primarily affect younger age groups. In 2020, the majority, so sitting at about 62% of those 25 years and older, actually reported using the same amount of cannabis. Only 19% of people 25 years and older reported using more cannabis, and that's compared to 31% of those aged 16 to 19 years and 31% aged 20 to 24 years. At the same time, 19% of people aged 25 years and older reported using less cannabis, compared to 38% of those aged 16 to 19, and 29% of those aged 20 to 24 years. So as we can see in the graph here, in 2021, young people reported a significant change in consumption habits. As the pandemic progressed, the percentage of teens aged 16 to 19 reported increasing cannabis consumption. It grew from 31% to 46%. Young adults also saw an increase from 31% to 40%, reported using more cannabis during the pandemic in the second year. So both age groups reported lower cannabis rates lower decreased cannabis in decreased cannabis use, in 2021. Youth also reported the greatest increase of frequency of use among all other age groups. So that's sitting at 40.9%. So in other words, not only were youth reporting using more often, but they were actually reported using more each time. And increased consumption increases the risk of overall consumption and substance use disorder. And I think that's an important point to highlight coming from a harm reduction program like YCAP. So, yeah.
If we talk about the CPSS studies, so like just over 1/3 of people who consume cannabis, like they increase their consumption. And like I also want to like mention over here, like that CPSS found that the young people who generally are like most likely to like consume cannabis were like more likely to increase their consumption during the pandemic, and also like among like 15 to 29 years like aged group, 43% reported that they increased their consumption during the pandemic. Yeah, so that's like almost like 50%, and mostly like CPSS and CCS, like they both like the research that we found, they both were the data were like mostly similar. So this was just like bridging the gap between the timing for the both survey.
Yeah, so just continuing on, the CPSS study also found that though the majority, so sitting about 54% of people who had previously consumed cannabis didn't increase their consumption during the pandemic. Many of them continued to consume cannabis most days of the week. So Canadians who increased cannabis use were more likely to report daily or near daily use of cannabis during the pandemic. Daily cannabis use not only increases the risk of cannabis use disorder, again, I like to mention, but it also increases tolerance and contributes to overconsumption and or cannabis poisoning. Again, an important point to highlight coming from a harm reduction program.
So the studies from CCS 2020 and 2021, the consumption by gender. So in this, like overall, like higher percentage of male, like 29% reported like they used more than female. That was like 22%. So it was like if we compare like 2020 and 2021, like males used more in 2021 than 2020, and also they used like more than females. However, like females were like more likely to increase and decrease both, like they increase and decrease like cannabis in 2020 and 2021 and 2020, and also more than males. And almost like 50% of males and females like reported that their habits of consumption did not change. So they use like the same amount that they were using before the pandemic. So yeah, here I also want to like mention that CCS has a limitation that like they are reporting the findings that they are having, like this is by sex at birth. So that means like also like so they are like not reporting the consumption by gender beyond male and female. So that's like creating the limitation. So where like if we include like other genders in the report, that will like increase and it will like fill the gaps that we are having in the data. So like, and that will like decrease the stigmatization in the genders. So yeah.
Absolutely, I love that point. And I also like the point of like when we're closing those gaps in knowledge, we're also closing gaps in service as well. And so people that may have not had that opportunity may have more opportunity when we have more representation within data. Here we just wanted to look at some additional considerations. I'd mentioned it a little bit before. The first one we'll look at is a longitudinal study of change in substance use from before to during the COVID-19 pandemic in young adults. So just to give a little bit of a background, the sample was comprised of young adults from a longitudinal investigation of about just over 1,200 youth recruited at age 12 to 13 in 10 Montreal area high schools. During COVID-19, data was collected from December 2020 to June 2021. The prevalence of cannabis use increased from 17.5% to 23.1% from before to during the pandemic. Reported increases in monthly, weekly, and daily cannabis use among 12 to 16-year-olds in Canada. And although these increases were less than those expected based on trends observed from 2018 and 2019, and I think our conclusions around that is that maybe cannabis legalization may have influenced those numbers. And low education and living alone were associated with higher risks of initiated or increased use of most substances, which is an important point to highlight.
So next question is like, what factors contributed to changes in cannabis consumption patterns among Canadians? And we are going to talk about it in the next slide. So this is the comparison between CCS 2020 and 2021, the reasons for increased consumption in past 12 months. So in CCS 2020, the most common reason for the increased use was relaxation, following by boredom, stress, and anxiety. That was like 65, 53, and 53%. In CCS 2021, it was like boredom was like the most common reason for the increased consumption. That was 62%. Stress after like and after that, stress, anxiety, and increased social gatherings, 60%, 55%, and 37%. Here I would like to mention that the most common reason for the increased use in cannabis for CCS 2020, that was relaxation, and that it was not like mentioned in CCS 2021, as they changed their survey questions and they did not provide the option relaxation in CCS 2021. That impacted the survey outcomes, and that's why we cannot see here like relaxation as an as a reason as an the reason for increased consumption in CCS 2021.
Thanks, Niyati. So here we actually look at increased consumption of cannabis since before the COVID-19 pandemic. And this is in consideration of the CPSS 2021. So we can see here that stress, boredom, and social isolation experienced during the pandemic appeared to be associated with increased cannabis consumption. So about 45% of people surveyed said that they often or always felt a lack of companionship during the pandemic. And this really does speak to the mental health gaps created by stress, anxiety, and social isolation due to the COVID-19 pandemic. As for factors that contributed to increased cannabis consumption during the pandemic, the most frequently given reasons were stress, and that sits about 65%, boredom's at 58%, and loneliness at 39%. Factors related to ease of access to cannabis also seem to have contributed to the increase of consumption by some respondents. And among those who increased their consumption, 38% indicated convenience as a factor, and 29% mentioned ease of access to cannabis products.
So here's the information about decreased cannabis consumption, reasons for decreased cannabis consumption in past 12 months. This is comparison between CCS 2020 and 2021. So in CCS 2020, we got relaxation as like most common reason for the decreased consumption, that was 18%, followed by closed store, lack of socialization, and anxiety. And in CCS 2021, we got lack of social gathering for 34%. After that, no reasons other and too busy. So yeah, here also like CPSS mentioned like among 12% of cannabis users who reported that their consumption decreased. The three most frequently cited reasons were like personal choice, such as like dislike of the effects of cannabis, that was 64%, followed by decreased opportunities for socialization, 28%, personal responsibilities, for example, like family or work, like obligation or too busy, that was like 16%. So like less numbers and reported reports and details that they are saying that they are not finding more reasons for their decreased consumption. That being said, that if someone has like more reasons for increasing their consumption and they don't see like the reasons for decreasing their consumption, they may be more likely to increase their consumption. So like providing like justified and valid reasons for reducing cannabis use may help youth and like and young Canadians to like move and turn towards like decreased consumption, like reduced consumption. So that is possible with like through like education and awareness. So we are like promoting that. So if they have like the proper information about cannabis, the risks and effects, they will be able to make like proper choices for their consumptions.
Which is why YCAP is so valuable. Just moving on to additional considerations here. Again, I did mention it before, and it is titled Measuring Self-Reported Change in Alcohol and Cannabis Consumption During the Second Wave of COVID-19 Pandemic in Canada. So this study presents nationally representative estimates of self-reported changes in alcohol and cannabis consumption since the onset of COVID-19 pandemic. So data was used from the survey on COVID-19 and mental health, and it was collected from September to December 2020. and basically was collected to calculate the prevalence of self-reported changes in alcohol and cannabis consumption. It was actually found that 15.7% of respondents self-reported an increase in alcohol consumption and 5.4% of cannabis consumption since the start of the pandemic. And I think it's important to highlight that socio-demographic disparities were observed, indicating that increased alcohol and cannabis consumption may be more prevalent among certain populations. And understanding the social determinants of health is critical to the development of harm reduction and mitigation strategies.
Here's the next question. How can this research support future best practices as we move through and out of the pandemic? So we are going to talk about in the next slide.
Yeah, so from all of our data kind of collection and our work that went into this project, we really wanted to come up with some recommendations from the gaps that we saw in the data. And we are young people, and we do have perspectives, and so we just really wanted to share that. And so the first one we have here is accessible resources and education. So just making sure that we're offering valuable knowledge and supportive resources to all young people, regardless of their opportunity or social location.
Then we have increased awareness. So just providing unbiased and evidence-based information about substances and also providing harm reduction techniques and also giving the information about their harms will help the folks to make an informed choices about their consumption. Yeah.
Absolutely. Yeah. And I think that does tie into our next point here is just implementation of accessible harm reduction and mitigation strategies. And so that really looks like sharing knowledge, sharing experience, and teaching helpful coping strategies to support mental health and wellness. Also exploring harm reduction strategies on various levels, as we know that substance use exists on a spectrum. Yeah.
And then increased community connections. So building the connections with the community, partnering with them, and then providing the meaningful resources to young people, so where they can talk or where they can get the information about cannabis and other substances. So yeah, they are not feeling helpless when they want to make any decision or they want to make any choices about substances.
Absolutely. And one example I like to use of this is child and youth care practitioners. They're an important part of service to young people. And the more that we are regulated to care for young people, the more that we can close those gaps in service. And then that actually brings us to our last point, is adequate mental health support. So we know that the data has really shown that COVID-19 has really changed the way that young people cope with life challenges. And most people reported that stress and mental health challenges were reasons for their increased consumption of cannabis. And so just providing healthy support strategies to cope with mental health challenges can really help mitigate the implications of mental health exceptionalities that were exacerbated by the COVID-19 pandemic. And that's, actually concludes our presentation for today. This is really what we had learned throughout our time at YCAP. If you have any questions, please feel free to ask away. I can try and answer, we can try and answer them, or I know a very smart supervisor that could probably help us out too. So just couldn't have done it all without the YCAP team. Just wanted to thank you all.